Yeah.
Hello everyone, welcome to the second in our series of COVID webinars. Today we will be talking about long COVID and it will be by myself, Riz and Dr. Josh. So we've already covered vaccines and the vaccination program. We hope you enjoyed it. Today will be about long COVID, a bit about symptoms and what we can do. And then next week, the plan is mental health and well-being. So what is long COVID? So following COVID, your symptoms can go on for weeks, even possibly months. And you may hear the terms long COVID or post-COVID syndrome being used interchangeably. But essentially, they point to whether your signs and symptoms and how long they've been going on for. So if it's been 4 weeks, following infection with COVID, we tend to call it long COVID. And if it's going beyond that, getting up to 12 weeks or after 12 weeks, then it's more post-COVID syndrome. Now, we had a few questions on this, which we'll address later, but generally, long COVID, the people who experience symptoms is about 10% of people. So that's quite a significant number, and it can go on for more than 12 weeks. There is research ongoing, so it's all very new to try and predict why some people are getting the symptoms and what we can do for this. And the government have announced about 10 million investment, hopefully more, with a plan to roll out these long COVID clinics across the UK. So it's an up and coming area.
So how might you feel after COVID? Well, basically, there are a variety of symptoms to look out for, really. And as you can see from the list, it's quite broad. So you may experience muscle fatigue and joint stiffness, a lot of tiredness and lack of energy. One of the key symptoms, as you know, is cough and shortness of breath in the acute illness, but this can actually last after recovering from the acute illness. You may also get things like loss of appetite, experience weight loss, and sometimes swallowing difficulties, although these are mainly associated with patients who've had to be admitted to hospital, particularly the intensive care unit. You may experience some sleeping problems, sometimes even memory problems. And as we'll talk more about next week, it can affect your mood, also give you a bit of anxiety or sometimes a low mood or depression even after having COVID. So you can see here there's a variety of symptoms that patients can experience after having COVID. So what support is there available? Well, one of the aims of this talk was really to let patients know what's available in terms of support after recovering from COVID. And so we thought we'd show you a couple of websites which are NHS funded. There's also a couple of good packs, and one of the symptoms that patients find quite distressing sometimes is the loss of smell and taste, which can last for a good period of time after the acute illness. So we thought we'd show you one of the websites which has a bit of advice about how to manage this. Well, I'm just going to just show you the Your Recovery NHS website, which is probably one of the first port of calls that we'd advise you to look at if you're experiencing some of the COVID symptoms. So it's just loading up now. So you can see here's the homepage, and at the top here, there's a bit of information about what COVID is, how it can affect you. And then I'd say these are the more kind of useful tabs, so managing the effects of COVID. So we'll come on to talking about breathing shortly, but if I just click here and show you, and you go to the breathing page, it has a lot of information about the reasons as to why you might be short of breath, and how this may affect you day to day, and also a bit of information about what exercises and things you might do, with some tips on how to improve this, which Riz will talk through shortly. Also, using certain positions and things can help with your breathing, as demonstrated here in the pictures. So you can see a lot of resources here, also some talking about how to get moving and active again. So we'd advise that this is probably your first port of call if you're thinking that you may have symptoms of long COVID. I'll just switch back to the presentation now. Okay, so Riz is going to talk through how can you improve your breathing after COVID.
Okay, so a lot of this is on the website. So if you don't remember all of this, that's absolutely fine. But a lot of people may find that after COVID, you have just this continued feeling of breathlessness. So going into breathing, 80% of your breathing is done by your diaphragm, which is that large dome-shaped major muscle of respiration. Now, when you've been ill, you're not moving your diaphragm as much sometimes. Maybe you're using your shoulders, your neck a bit more. And sometimes you have patients, we speak to us often with saying they feel like they're shallow breathing. But when you're shallow breathing, so using your neck and shoulders more, not moving that diaphragm much, you feel more breathless, you feel more tired, and you're actually using a lot more energy than you normally would be for your breathing. And so you're stuck in a bit of a vicious cycle. So that's why using the breathing control technique, and Josh, if you move on, is really important to try and help that breathlessness feeling. So Josh showed some pictures, but sitting in a nice supported position, breathing in through the nose and out slowly through kind of pursed lips. And if you can't manage to do that through pursed lips, then that's fine, but if better if you can. And you're aiming for a ratio of in one, out two. Okay, and you're really trying to relax these shoulders, relax the chest, and allow that tummy to rise. And you just want to do this as frequently as you can in just 5 minutes at a time, little bursts. So you're not doing a lot of this in one go, just throughout the day, and build it up how much you can do it. There's a little bit more information on the side, which essentially is a picture that I believe is on the website about how to do it. So in through your nose, out, relaxing. And we've also added that if you're feeling breathless, some people have asked us if it's worthwhile investing in a little oxygen saturation probe. Absolutely, there's no harm in you having that if you can, just to measure how much oxygen you're getting, going around your body. And you can always let us know if you're worried that that number is low, of course. But mostly you'll find that it's generally within the normal range, is that feeling, and it's just about improving, learning how to breathe again correctly to try and get as much of your air in as possible.
One of the other major symptoms is cough that patients experience, and sometimes this can linger for quite a long time. And it can often either be a very dry cough, or sometimes it can be productive. So you may actually be coughing substances up from your lungs. And there are just a few tips really on how to help with that. So sometimes if you feel like there's something stuck in your throat, it helps to close your mouth and swallow a few times to try and basically soothe the back of your throat. Breathing in and out of your nose, taking very frequent small sips of drinks, either warm or cold. Sometimes lozenges, which you can get over the counter from the chemist, can be helpful, as well as steam inhalation. Especially if you've got a bit of a productive cough, sometimes the steam can help move things around a bit. But obviously be very cautious when using hot water to generate steam. You can use things like warm honey and lemon in warm water can be helpful. And also moving around and changing position can sometimes help. And as well as helping with your breathing, doing the breathing exercise Riz mentioned can also help with your cough. And this diagram here just gives you a bit of an outline. Again, it's available on the website, of kind of cycles of how you can do some breathing control techniques, which we talked about, and a couple of really big deep breaths followed by breathing control. And you can do this over 10-15 minutes every couple of hours throughout the day, and then build it up as you start to improve. Another thing that people complain about quite often is fatigue, and it's a very common presentation after COVID. And like with any viral illness, so even with a normal flu, people can experience fatigue sometimes up to 6 weeks. And as we know, COVID is a bit more severe in terms of its outcomes compared to our normal flu virus. So it won't be surprising if after recovering from COVID you experience difficulties doing your normal tasks and activities whilst you're recovering. And it's your body's normal response to fighting infection. So the main message is really be kind to yourself. It does take time to recover. and make sure you're making sure that your environment around you is as good as it can be in terms of getting enough sleep, resting, making sure your diet is good, and trying to move regularly. It doesn't necessarily mean you have to go on long walks, but just moving around the house regularly rather than just sitting down all the time will start to help your body get used to doing exercise again. And it may be that you need a bit of time off from work or your normal activities during this recovery period, and that's definitely not something that's uncommon. And this diagram is just quite helpful in terms of getting people to put their energy levels into perspective. So if you imagine that in a day you have 10 bags of beans to fuel your day, prior to COVID, it may have only taken you half a bag of beans to get out of bed. Whereas after COVID, that may have gone up to 4. So it may be 4, if not more, times harder to do a certain activity than it was before. And you only have a certain amount of energy which can conserve you throughout the day. So just bear in mind, obviously, you have to take things easy as you're recovering from COVID.
So talking about returning to exercise, so should only really be thinking about going back to exercise you're previously doing when you're managing your normal day-to-day activities. If you're still struggling with them, then trying to add in exercise that you possibly might have done pre-COVID is something that you're going to find really difficult to manage. So you have to be a bit sensible about your approach to returning to exercise. Now, I found some studies that suggested doing a bit of a graded return to exercise. This study was basically regards to pneumonia, but it was quite interesting because actually they said it goes up to 6 months, this little plan to kind of get yourself back. So it really shows just how gradual these steps are, and it's not about a week or two. Some people will get back very quickly, but not everyone. So just be, as Josh said, be kind to yourself. So the first week, maybe you can think about doing, small amounts of stretching, then you build up to your walking, and you're gradually increasing this each week, and always can drop back if you're not quite managing it. Now, a lot of people that I've spoken to kind of feel a little bit frustrated that they're not making progress as quickly as they expected. And I think sometimes, this is not for everyone, but sometimes a diary can help, because you may have gone for a walk 1 week for 5 minutes, and in fact you really couldn't manage anymore. And then the next week or next day or whenever you next go, it's 10 minutes. And to you, that might not be that big a step, but actually if you wrote this down or had a diary, you might realize that you are making small amounts of improvements. It's just not being as quick as you normally would expect it. So it varies, and some people say muscle aches and pains can last up to 4 weeks and then 3 months before you're getting your kind of coughs coming back. This was all in the study that was related to pneumonia. But going back to exercise, it's just about making those small steps, doing what you can manage, and generally increasing as you're finding you can. If you have got very, very severe symptoms, then do be cautious. Set yourself small goals to see what you're able to achieve. And then main take-home point is, remember, it takes a lot of time to recover, and you might not get back to where you were as quickly as you would like. But you can with just small steps. Now, I think we mentioned about the loss of smell on the websites, which we'll go into in a bit. But about half of patients with the virus will lose their sense of smell, and then smell and taste kind of go hand in hand sometimes, and it can be incredibly frustrating, when you can't smell or taste your food. Most people will recover the smell and taste after 2 to 3 weeks. Some people, it's months before they get their smell back, and they may find that they get something called parosmia, or they get distorted, unpleasant smells that they really don't like. But it's important to know that this is part of the recovery. So it does mean that your smell is on its way back. It's just a bit of an unpleasant time when you have that period. Now, it doesn't always come back all in one go. It's just gradual. And definitely, I think I've had with some patients saying, I feel almost 50% back. So it is a gradual process. We don't generally need to do any formal investigation, so they're not usually required to do a scan because it doesn't really help. The prognosis is good, but there are things that we can do to make things recover quickly, and something like smell training has been shown to help. Now, smell training works not just for post-COVID, it works for other post-viral, any smell loss that you get. You're aiming to do this twice a day, every day for a good few months. We've just mentioned other techniques before we go into smell training on the website, but nasal sprays, rinsing with saline, all of these available over the counter have been found to be beneficial. And then there's some studies that say omega-3 fish oils can be useful as well. Now, Josh will just kindly click onto this website. This is one of two. We've included a whole list of really useful NHS websites that are specifically for smell and taste, but it goes into this all about COVID, all about knowing that you're not alone with this loss of smell or taste. It goes at the top into what you can do for smell training. There's a little video here at the bottom answering questions in regards to the smell loss, and here you can see the smell training, how to smell train, etc. So this is a really useful website talking through exactly what you can do. And they might, this is a charity, so they do suggest donations, but it's absolutely free to use. They do have this, I do believe they sell certain smelling training kits, but actually they also give you techniques of things you can use at home. So this is free to use. It's a really, really good website. And this will be included on our website page for you to find. Going forward.
Yeah, so I mean, those are the key things that we wanted to cover in this week's webinar. So around long COVID, and we're not going to touch on mental health and well-being today because we feel it's an important topic in itself. And so we're planning on doing another webinar next week, looking at mental health and well-being in the context of COVID, and also going through what services and resources are available, not just nationally, but also in the local area, which many of our patients will be able to access. So do tune in for that next week. So lastly, we're just going to finish off with a couple of FAQs that we had after sending out the text message ahead of these webinars. I can start off and go through my questions. So I had a question from a patient asking, can COVID-19 cause nerve damage? And now, this is quite a specific question, and I guess we've just talked about smell training and loss of smell, and the way in which your smell is, or in which it works, is by nerves carrying messages from your nose to your brain. So the short answer is yes, there is some evidence to suggest that it can cause some types of nerve damage. The most common one we know about is to do with smell, but there's not much evidence in terms of other nerves that it can affect. But I'm sure over the coming months, with more research, we may uncover whether that is or isn't the case. Another patient asked about experiencing low mood, anxiety, and problem sleeping, and also fatigue. A month following having COVID. When will these subside? Well, I hope during this webinar we've kind of touched on some of those points, and as I said, we'll talk more about the low mood, anxiety element next week, and well-being. I think the message to get across really is that up to 10% of patients can experience symptoms up to 12 weeks and beyond. So again, with more time, with more investment in these long COVID clinics, I'm sure we'll get more evidence as to how long these symptoms take to surpass. And then someone else asked, what medications are available or recommended for early stage treatment or alleviation of COVID symptoms, either over the counter or prescription only? Well, there isn't really any recommended prescription medication for treating COVID in terms of in the community. And in terms of over-the-counter medications, we can only really treat COVID symptomatically. So by that I mean if you have a temperature, we'd advise taking paracetamol, and that is really the only medication that is advised to take, particularly over-the-counter with regards to if you have a COVID infection. And now I'll just hand over to Riz.
So a few more questions that we had. This one question was part of a longer question, which I believe I answered last week, but someone mentioned they have tiredness on exertion or feeling like they've got less breathing capacity? Could this be long COVID? Certainly those symptoms are long COVID, but then I think in this particular questions, they think they've had them for a year, but I'm not sure from the question whether it means you've had the symptoms for a year or whether you had nothing after COVID and you've suddenly got these new. Now, if they're ongoing for a year, then certainly, definitely straight after the virus, it would be long COVID potentially. But if you've had nothing and then you suddenly got these symptoms, then it would be unusual to just develop this and put it all down to long COVID. So I think in that particular case, if it's all new and you had COVID, you know, a good 6-8 months ago, or in this case, nearly a year, then it's worthwhile booking an appointment to discuss what you're going through and you're feeling, because other things can cause breathlessness and fatigue. Part of that same question was, can you tell me if I've had the virus? Now, I'm assuming that means in regards to antibody testing. Now, that's not something that we can currently offer you on the NHS through your GP service. It is available privately, and you may have seen that. And the important thing with antibody tests, and I think Josh may have mentioned this last week, is that even if it comes back negative, it doesn't mean that you haven't had COVID in the past, because there have been people that have had positive COVID tests and still had a negative antibody test when they've done it privately. Now, another question that we asked was how long COVID can last for. I think we've talked about that. It's so variable from person to person. Some people have very mild COVID symptoms and then they recover quite quickly. Others have a little bit more of a challenging time with COVID, not necessarily in hospital with it, but still are left afterwards with this fatigue or breathlessness. And it can take weeks, like we said, but it can go on for months. And generally, you know, it's thought a good, you know, you might be left with those muscle aches, those breathlessness, and step by step things just generally improve, possibly fatigue being something that is a bit longer lasting. So unfortunately, I can't give you specific answers to that, exactly how long it lasts, because it is so variable between person to person. Another question is, how prevalent is COVID? What do we know about it? What research is being done? So I think we've said about 10%, and I think Josh has also mentioned roughly of people who, once they've had COVID, could be left with long COVID. What do we know? Well, it's ongoing research that's going on. We don't know why some people get long COVID or post-COVID syndrome and others don't. That's research is ongoing as to why that is the case. And the question was, what research is being done? So there's lots of studies, but there are two major studies that are being involved in looking into the long-term health and psychological effects of long COVID and COVID. One is called the Post-Hospitalization COVID-19 Study, PHOSP COVID, and that's been done in the UK. And then there's another one, the International Severe Acute Respiratory and Emerging Infection Consortium, Global COVID-19 Long-Term Follow-Up Study. Well, that's a bit of a mouthful there, but that's another long study and quite a big study being done internationally. So research is being done, and I suspect as time goes on, we're going to find out more. And there's also definitely, like we mentioned, more and more clinics going to start popping up across the UK as the government invest more money into this, you know, new area of medicine. And I think that's all my questions, Josh.
Okay, perfect. Well, thank you very much, everyone, for listening again this week. We hope you found it useful. And as we said, we've put some links below the video, which are some of the resources we talked through today. So feel free to have a look at those. And next week, we're planning on doing a session on mental health and wellbeing during COVID. And we'd really appreciate it if you could leave us some feedback. I've left the link here on the presentation, but also it's in the YouTube description. So it'd be great if you could provide the practice with a bit of feedback. And thank you very much, and we will see you next week.
Yeah, thank you, everyone.